Honorable Aceng.
There is no evidence of community transmission in Uganda at this point in time. 2, as evidenced from Rakai, Chotera districts, communities in border districts are at high risk. 3, regarding population groups, road law enforcement officers are also at high risk. 4, the early institution of the 35 presidential guidelines and the Ministry of Health standard operating procedures have interrupted and controlled possible transmission of COVID-19.
Truck drivers are the major challenge for the Ministry of Health to date. According to statistics presented by Health Minister Dr. Ruth Aceng, the number of truck drivers with the infection has now surpassed the total number of infected Ugandan nationals.
To date, the country has registered 139 confirmed cases of COVID-19. 73 are Ugandans, 35 are Kenyans, 19 are Tanzanians, 3 are Burundians, 2 are Chinese, 1 is a Canadian, 1 is an Indian, 1 a Congolese, 1 a Rwandese, and 3 Eritreans. Of the 139 confirmed cases, 79 are truck drivers, and again I'll give the breakdown of truck drivers. 35 are Kenyans, 19 are Tanzanians, 1 is a Burundian, 1 is a Rwandese, 3 are Eritreans, and 20 are Ugandans.
The ministry has now developed proposals that will be implemented to prevent further spread of the infection, specifically targeting truck drivers.
And one of the areas is to ensure that we build an army of negative drivers who are tested from origin, remain quarantined within the system, and continue to transport cargo. They also directed that we consider testing 24 hours before departure. That will require that the testing areas are nearer to the border points of crossing, because if they are further away and the drivers are not in the quarantine system, they can still get exposed and acquire infection.
However, Dr. Aceng said these decisions await signatures from the region's presidents. In an effort to scale up the country's testing capacity, the ministry has identified laboratories that can be activated for testing, apart from the Uganda Virus Research Institute.
The following laboratories have been assessed and are deemed ready. 1, Makerere University, Department of Microbiology and Immunology, which has already been activated to test the rapid survey samples. 2, the National Health Laboratory Services, or CPHL, as most people know it, will dedicate a capacity of 2,000 tests per day to COVID and will continue to provide HIV viral load and EID services effectively. 3, the Infectious Disease Research Collaboration in Tororo District. 4, the UVRI Plague Laboratory in Arua. 5, Gulu University Laboratory. 6, Rakai Health Sciences Laboratory in Rakai District. And 7, the laboratory in Fort Portal Regional Referral Hospital. In addition, we have equipped laboratories at Mutukula and Malaba borders with gene expert machines to reduce the turnaround time of results for inbound truck drivers.
Walter Mwesije, NTV.